Hello, I'm Commissioner Henry Mitchell III. Welcome to District Dialogue. Today, we've got an interesting topic that we're going to be talking about. This is something that's near and dear to my heart, meaning that I've got a gentleman that's going to introduce himself, and he's a doctor, by the way, and we're going to be talking about prostate cancer, this silent killer that most men, especially African American men, are not truly aware of. So I thought I'll bring on a doctor who happened to have helped me through my prostate cancer surgery. And here we are. So without further ado, let me introduce you, the District Dialogue family, to my dear friend and my savior. Yeah. All right, that was a good introduction, okay. Dr. Masanji, welcome to District Dialogue.
Thank you.
Well, let's do this. Let's start first. Start with who you are and your position, and we'll talk about how we got here.
Sounds good. My name is Gaspar Msangi. I am a urologist at Wellstar here in Douglasville. I was born in Tanzania, in Dar es Salaam, and I grew up there. I also spent a lot of my time in Kenya. And I came to America in 1997.
Okay.
I went to Waldorf College in Forest City, Iowa. And then I went to St. Olaf after that, and that's where I graduated from St. Olaf College in Northfield, Minnesota. And then I went to medical school in Mayo Clinic in Rochester, Minnesota. And after that, I went to residency in Michigan at Beaumont Hospital at that time. And I finished residency in 2014. And I started working at Wellstar then, and I've been there since then.
Wow. Great introduction. So, what got you into this field, though? I mean,
urology?
Yes. What brought you there, though?
So, I always wanted to be a physician ever since I was a young kid.
Okay.
And my idea of a physician was a primary care doctor.
Okay.
You go in, you sit down, they listen to your lungs and give you advice, give you some medication, and advise you on how well to live. And then I went to medical school, and I was surprised at how many different specialties there are. And then I thought, I don't have to be this. I can be whatever I want to be. So
Correct.
I thought I would choose a specialty that I can do things with my hands. So I thought I'd be a surgeon.
Okay.
And I tried to see what general surgery was like, and I didn't quite fit in. And I spent some time with urologists, and they seemed to be my kind of people. Laid back and great sense of humor. Dealt with very important things. Some of them can be very intimate and embarrassing things to deal with.
Yeah.
And they seem to know how to engage with their patients. They do surgery, and they also do office work in the clinic. They do simple things like a vasectomy. You just use simple tools and your fingers to do the surgery. They do very complicated surgeries like robotic surgery.
Yes.
They do things with endoscopy, and so everything that a physician does, a urologist gets to do. Read films and talk to patients and do surgery and endoscopy and all these things. So we see men, we see women, we see young people in their late teens, we see old people.
Got it.
And so I liked the variety that urology provides.
Okay, so I see now kind of understanding your mindset of how you got here, which is good, because I'm glad that you were my surgeon. So first of all, thank you for helping me back in 2019, I think it was.
Was it?
Yeah, 2019.
It's been a while. Okay.
Yeah, it's been a while. So
before
2019.
Pandemic, that was a different
I know, right before the pandemic. So, but thank you, and thank you for because that is a mental thing that I don't think people realizes, that when you talk about prostate cancer, kind of how it affects that person mentally. Now, physically, I was in great shape, but we'll talk about that a little bit later about because I was doing well when it crossed my path of prostate cancer.
Yes.
Didn't want to believe it.
Right.
Kind of said, no, that can't be. I was still out running, jumping, shooting basketball, doing everything.
Right. So that's the problem with prostate cancer is that Most of the times nowadays, we find it when it's still localized, when you have no symptoms.
Yeah.
Unlike other cancers, like let's say you have a skin cancer, you can actually see a lesion. There's a difference in my skin. Or if you have lung cancer and you're feeling, shortness of breath and you're not as active as you used to be, you feel tired. So all these symptoms, and you're seeking help to relieve your symptoms, and then you're told, oh, by the way, your symptoms are caused by cancer. You're more readily open to having surgery or whatever kind of therapy that you'll need.
Well, because it's in the forefront. It's right there. You can feel it, see
you
it.
Can see it.
Yeah.
You can feel right.
Yes,
it's affecting your life.
Yes.
You want relief.
Yes.
Now,
yes.
with prostate cancer, I mean, it's a mixed bag, because in the olden days, prostate cancer, people used to be diagnosed after having symptoms, difficulty urinating, pain in their back or in their hips, because the cancer is spread and it's causing all these problems. Nowadays, thank God, because of PSA, we're catching prostate cancer very early. And so you don't have any symptoms. Most people don't have any symptoms.
Correct.
And so it's difficult when somebody is very healthy, like yourself.
Yes.
You like you say, you're playing basketball.
Yeah.
You have great sexual function.
Yes.
Your urination is normal.
Great.
And you just went for a screening and you're told.
And then you had to tell me that you got prostate cancer.
Right.
Through my biopsy.
Right.
Like,
so
you're wrong.
Right, exactly. It's like, wait, what are you talking about?
Yes.
I feel great.
Yes.
There's nothing wrong with me.
Yes.
It's very difficult for people to accept that diagnosis because you're fine.
Yeah.
Yes.
But you said something to me a few days or so ago that you're right. You don't really notice anything. You don't really notice. But when you do notice it, you're probably at the latter stage of you got some serious problems here now.
Exactly.
So please elaborate on that for me.
So that's how prostate cancer used to present. And in places where there's not very good access to healthcare, it still presents that way.
Okay.
Whereby people come in with obstructive urinary symptoms. They're trying to urinate and they cannot. And they're having pain in their bones because the cancer has spread to the bones. And I mean, if you are presenting at that stage and the cancer is out of the prostate in other parts of your body,
Right.
your choices, your options are limited.
Limited. Got it.
But if we catch it very early, I mean, we can take care of it. I mean, look at you.
Yeah.
You're a great
Well,
example.
Absolutely, because I had all of the options.
Yes. At the time when you presented, you had all the options.
Now, I didn't just present it. You just kind of said after you're looking at your PSA, okay, but go ahead. Okay.
Yes. Yes.
So, but yeah, go ahead.
So, I mean, I don't want to scare people.
Right.
In that, because the symptoms of prostate cancer can be very similar to the symptoms of prostate enlargement.
Yes.
Okay?
Yes.
So, people, just because you have difficulty urinating, please don't assume that you have cancer of the prostate.
Correct.
Okay? Because there are some other things that can lead to those symptoms. A very common reason. So, as we grow older as men, our prostates become larger.
Correct.
And if you can think
And that's normal.
and that's normal.
Okay.
Yes. And if you can think of the prostate like an apple, and the apple core is a space through which urine passes, when that apple gets bigger, the core gets smaller. And urine is trying to pass through this very narrow opening. That's why you may have, your stream becomes weaker. You're spending more time in the bathroom. You're waking up at night to go urinate. All those things are not necessarily because of cancer of the prostate. It's just happens with enlargement of the prostate, which is a natural process that a lot of men go through. And there's some men who can have a very large prostate without any symptoms at all.
Got it.
And some men whose prostates are not so large, but it's just enough to cause enough obstruction to give them symptoms. So if you're having these symptoms, don't assume you have prostate cancer, but please don't ignore them.
Correct.
Because even though it may not be prostate cancer, you don't have to live suffering, waking up at night, interrupting your sleep, not getting enough rest, because these things can be treated as well.
Can we say that's how it got the name, the stigma of silent killer, because it kind of catches you if you have signs, then you're probably at the latter stage of, you need to do something like right away versus catching it early, because you don't really, I noticed nothing.
Right.
Without the PSA run.
You wouldn't have known that you had cancer.
At all.
Right.
At all.
So that may be the origin of that.
Okay.
The other reason that I think could be this is people are ashamed to talk about these things. People, always assume that the only way to screen or diagnose prostate cancer is through a rectal exam. And nowadays, that doesn't have to be done.
Right.
But you won't know that until you go to your doctor and actually have screening. So it's very important to don't make assumptions. Go talk to your doctor and find ways to screen for prostate cancer.
Well, that's how I did. I had no knowledge of it other than my physician said your PSA has been kind of elevating, and it got to a point where she said we might need to take a real look at this.
Right.
And we did.
Right.
And voila.
Yes.
Okay. But go ahead. I'm sorry. Go ahead.
I was going to say, maybe let's talk about the whole process from the beginning to the diagnosis of prostate cancer, how things should happen or how things happen.
Sure. Yeah.
All right.
Okay.
So nowadays we screen for cancer of the prostate cancer. And men ages between 50, I would say, until 70 should be screened. Now, there are special populations that can be screened earlier.
Okay.
And if you happen to have prostate cancer in your family, an immediate family member, your father, your son, your brother have prostate cancer.
My two uncles and my grandfather.
Okay, have prostate cancer, right. So
and died from it.
Wow, okay.
They passed from it.
Yeah. So you should be screened earlier, maybe even at age 40, okay? But the most important thing is just talk to your physician. That's the most important thing, and have this discussion between you and your physician. What they probably will do, and if you don't want to have a rectal exam, it's okay. What they probably will do is order a PSA. And PSA stands for prostate specific antigen.
Got it.
It is a protein we check in your blood that gives us a clue whether or not you have a high risk of having prostate cancer. Now, if your PSA is elevated, doesn't mean you have cancer of the prostate. It just means that we need to investigate further, because there are many things that can make your PSA elevated. Prostate cancer is just one of them.
Got it.
Okay? So sometimes we may repeat the tests, and then sometimes it'll come down, and if it continues to go up, there'll be other tests that we'll do. Nowadays, we'll probably do an MRI of your prostate, and then followed by biopsies of the prostate.
Yes.
And once you're diagnosed with prostate cancer, not all prostate cancer is dangerous and needs to be treated.
Okay.
Some prostate cancer can be monitored. You know, we continue monitoring your PSA closely. We alternate doing PSAs versus MRIs versus repeating biopsies. And you can live your life with prostate cancer and die of something completely unrelated to prostate cancer.
Got it.
So just because you're diagnosed with prostate cancer does not mean that you have to be treated. Yes.
So we're on the topic of prostate cancer, and we're doing a big rally in September, when that's the actual month of Prostate Cancer Awareness Month. Why prostate cancer awareness is important, and why should men pay close attention to that?
It's important because it is something that, if caught early, can save your life. That's really the baseline. So people need to know that there are ways for us to find out whether or not you have prostate cancer early, and to take care of it so that you can have a healthy life afterwards.
And understanding the prostate and the role for men, for men's health, understanding the prostate and the role that it plays in men's health.
Yes.
Because there's a purpose for the prostate.
Yes.
Correct. Okay.
Yes. So the prostate primarily is used in reproduction.
Okay.
That's what we think.
Yes.
In that it produces PSA, which helps in liquefying semen and makes it easier for sperm to swim, get to the egg, and reproduction happens.
Correct.
And it's also important in sexual function. Now, after reproduction, you don't have to have a prostate to maintain a healthy, normal life.
Got it.
So the older you get, in general, the older you get, the more likely you'll have cancer in any part of your body, including the prostate.
Right.
And so if you have cancer of the prostate, one of the ways we can do is to treat the prostate. And one of the ways is to remove the prostate. And your life can continue. You can have just a normal, healthy life after removal of the prostate. In fact, a lot of people who have difficulty urinating may find it very beneficial to have their prostate removed if they have very large prostates, even though they may not have cancer.
Right.
Yes.
Yeah. Because I had a brother who recently had his carved out, or
oh yes, it's called a transurethral resection of the prostate, where we go in and you could say we we rim the inside to create, again, if you can think of
the apple.
prostate like an apple. Exactly.
Yes.
So we're going to create a big donut hole inside of the apple core so that there's a wider space for urine to pass without obstruction.
Got it.
Yes.
And who is most important, or who's most at risk when it comes to prostate cancer? I mean, with the prostate cancer, who's most at risk?
So in America, African American men are at higher risk of prostate cancer, and people who have family history of prostate cancer are at higher risk. Yes.
And as you stated, most African American men, but overall men.
Men in general, yes.
Right.
We're the ones with prostates. Women
right,
don't have
right,
prostates.
right, exactly,
Yes.
exactly. But you mentioned earlier that you do also have these kind of conversations, not in reference to prostate, but with conversations with women. Talk to me about kind of, I'm assuming with your spouse.
Yes.
You know.
So it's women especially. Thank God for them, because
Yes.
I see a lot of times men coming to the office because their wife wanted them to come to the office to be screened for prostate cancer. So yes, they do play a big role in ensuring that the men are healthy. So yes, women need to know what the guidelines are and why it's important to screen for prostate cancer, because then they can encourage the male members of their
because we're hard.
family.
Men are just pretty tough characters who just will drive on. You know, leg dragging off, ear bleeding, like we'll be all right, put some dirt on it.
Right. So we we are raised to be tough.
Yes.
And not to, not to be, it's seen as a sign of weakness to seek help sometimes. And nobody wants to accept that they have something wrong with them.
Right.
And so we just suffer in silence, which is not the right thing to do.
Now, you mentioned this earlier about, is it important to know your family tree, your family history?
Absolutely.
And trying to, I guess, get ahead of this potential prostate cancer.
Yes. If there are family members in your family who have had prostate cancer, you are at an increased risk of getting prostate cancer. So you should have your screening, and you should have it earlier than the general population.
Got it.
Yes. Maybe even starting at age 40 instead of waiting until age 50.
Okay, so 40 is a good time, at least, especially if your family tree.
If you've had family history of prostate cancer, yes. Somebody in your family has prostate cancer, especially immediate family members, a son, a brother, father, you should have.
Well, I said to my mom, Mom, when she told me about my grandfather and my two uncles, and I said, well, Mom, when were you going to tell me?
Yeah.
It's like, I might need to know this.
Right.
But what are some of the common signs? Because I think I heard you said earlier, some of the common signs are, if you get a sign, you probably are late in the game. As opposed to trying to get it early and capture it early. But go right ahead.
So I think all men should be screened for prostate cancer, and that's the best way to find it. Now, the unfortunate thing is that the early signs of prostate cancer are very similar to signs of enlargement of the prostate without cancer. I want to make that very clear.
Got it.
Because it's very common for men to have difficulty urinating as they grow older. I don't want people to assume just because they have those symptoms, they have prostate cancer. So obstructive symptoms, whereby you're going to urinate and it takes a long time for the stream to initiate, or as the urine is coming out, it's very weak force. Instead of making a trajectory, it falls on your toes. It takes you a long time to finish. You're in the urinal, other people coming and going, you're still going. That doesn't necessarily mean you have prostate cancer, but yes, prostate cancer can present that way if it's advanced and it's causing obstruction. Other things, prostate cancer can go to your bones, and you can have pain in those bones, in your hips, in your back. Yeah.
So some of those things you would call myths, or just thoughts that you might have, but you really don't, or you really don't know until you do a PSA?
You have to go talk to your doctor. They will get a PSA, and if appropriate, they will order imaging like an MRI. If appropriate, then they'll talk to you about doing a biopsy. Now, the one thing that diagnoses prostate cancer is a biopsy.
Okay.
You cannot tell whether somebody has prostate cancer from just a PSA or just an MRI. You have to study the tissue by a pathologist to give you that diagnosis.
I went to that dance. I went to that dance, the biopsy dance, when they drilled. Okay, but go ahead. I'm sorry. Go ahead.
I was going to say the PSA and the MRI can give you clues to
Yes.
make you understand that you're more likely to have cancer of the prostate. But until you get the biopsy to say you have cancer of the prostate, don't make that assumption.
Got it.
But do go be seen to make sure that you do.
Well,
not.
I know that's the PSA was a sign on my behalf,
Yes.
but then the biopsy and others kind of confirmed that
Yes.
this is what this really is.
Exactly.
And now the question is, what are you going to do about it?
Right.
And I think I shared with you, my daughter said, you're going to do something, Dad. Because my option, at least one of my options were we can just wait and see what happens.
Right.
You might be fine.
Right.
You know.
So yes, for people who are young and healthy and have a life expectancy of more than 10 years, yeah, and if the prostate cancer is low risk prostate cancer, that's absolutely correct. One of the options is to have what we call active surveillance. So you're not treating the cancer, but you're not completely forgetting about it.
Right.
You're monitoring it very closely. So that
Yes.
if there's any changes, if it seems like it's progressing, you go in and
Right.
you have a discussion about what to do and what kind of treatment you
But
might
couldn't
choose.
that put you at the latter stage that may not be good for you if you wait to see and find out that it really is bad? So
You're not waiting to see if it really is bad. So
Okay.
let's say you
Okay.
get diagnosed with prostate cancer
Okay.
and your doctor tells you one of your options is to do active surveillance.
okay.
You're not waiting until it's bad. You
Okay.
are actively monitoring it.
Okay,
So
okay,
even,
okay,
you know,
okay.
you're going to see it.
Okay.
You're going to see the changes.
But you would
And
have
then-
done the biopsies and others to make sure that this is what it really is.
Exactly right.
Okay.
Because
Okay.
not all prostate cancer should have active surveillance.
Okay.
So depending on what your biopsy is, depending on what your PSA is, depending on the imaging, what stage it is, you can be advised to have treatment and not wait, or you can be advised to have active surveillance.
And I'm sorry, and talk about I did the robotic surgery.
Yes.
Sorry. Is that mommy calling? But that's okay.
I'm so sorry.
That's okay. But why you taking that call?
I'm not taking a call.
That's fine.
Yes.
But so talk about the robotic surgery side of it.
Yes.
Versus the normal cut.
Yes.
I don't know. The suture
open-
side.
the
Okay.
open
You know the
procedure.
terminology. I don't know all
Right.
that. So
No worries, yes.
speak to that one just for the short story on that.
So, robotic surgery has really revolutionized surgery, especially pelvic surgery. And initially, it started in urology with the removal of prostates because the pelvis is very deep. It's not that easy to get your hands in there and actually be able to see what you're doing.
Okay.
So robotic surgery allows us
Got it.
to make these small incisions in the belly and get a camera in there and get these articulating arms that really function like your own arms. And you're able to see very clearly all the structures. You're able to take exactly what you need to take. You're able to preserve important structures like nerves. So it's a very good way to remove the prostate nowadays. It's not easy to find urologists in America that still do open radical prostatectomy
Okay.
for prostate cancer.
Okay.
As a matter of fact, when I was in training, I think I saw one open procedure to remove the prostate, and that was not usual. I was there for 6 years, and
Wow.
the whole time I was there, we only had one.
So the robotic move that's the future. That's kind of
That is the current and the future. Yeah. I doubt. I do not know. I shouldn't. I don't know for sure. But I'll be
Understood.
surprised to find a urologist that still does.
you probably got an OG
open.
out there. You know what OG is,
Maybe.
right?
Yeah, I know what an OG is.
Right.
Yeah.
Okay, so-
But the radical prostatectomy, most of the times we do it robotically. There are other ways to do it, like through the perineum. If somebody has had a lot of surgery in the abdomen,
Got it.
but fewer and fewer urologists are learning that skill.
And from my understanding, from hearing from you and others, that you heal faster. You
do.
know, you have a better shot at kind of getting up and running. Because
Yes.
I don't know why y'all did me this way though, but when I left surgery,
Yes.
got to my room,
Yes.
you guys had me walk up and down the hall a couple of times. Like, wait a minute, I just got out of surgery.
That's right. You are there not to just rest, sir.
I thought I was supposed to kick my feet up and have a moment, but no, you was like, let's get up.
Yeah,
like,
that's right.
Huh? Okay.
Yes.
But there's a good and a plus to now technology has improved to that degree of, helping you heal faster
Yes.
and get up and move. Because I was at a festival with what is it? I had to wear this bag. No. What is it that the Jesus? What's the name of the bag that you get that feels the urine and all that stuff?
Oh, a Foley catheter.
A catheter.
Yes.
And I didn't like anybody named catheter. You know, but I used that for a long while. But at the end of the day, I was up and running and moving just that fast.
Yes. So, I mean, you'll be surprised to hear that actually nowadays, urologists will send their patients home the day of surgery.
Oh, wow.
So you'll have your prostatectomy and be home that afternoon or evening.
Mm-hmm.
So all that because of robotic surgery.
Mm-hmm.
You know, if you take urologists from the 80s and 90s and you tell them a prostate patient had their radical prostatectomy and went home the same day, you know, they'll be blown away.
Wow.
Yes.
So what kind of encouraging words would you like to give to those men that definitely need to have this conversation with their physicians, definitely need to get tested, definitely to kind of make sure, especially if you have a history in your family, and if my mom didn't tell me all this though, but that maybe don't even know. So what kind of encouraging words would you like to provide to those that just really, well, like me, I was feeling great.
Right. So I would like to say that even though prostate cancer can be life-threatening, the good news is that we have ways to screen and find it very early. Okay, that's very important. It's not a death sentence.
Right.
So go have your health screening. Go talk to your physician. Have that conversation, and be open to at least getting a PSA. You don't have to worry about a rectal exam. I know a lot of people don't do PSA screening because of a rectal exam. You don't have to have that.
Correct.
At a minimum, have your blood drawn.
Correct.
And have that conversation with your physician. And when you go see your physician, it'll be good because then you can check your blood pressure, because that's another thing that a lot of us, especially of African origin, people have high blood pressure. They have no idea they have high blood pressure, and you live your life thinking you're fine, and by the time signs and symptoms start to show, it's quite advanced, and soon you've lost your kidneys and kidney function, and you're surprised. So just in general, go see your physician at least once a year. Have this discussion, about prostate cancer screening. You don't have to do it every year to screen for prostate cancer, but you should see your physician at least once a year.
Right.
It could save your life. It has saved many lives.
And that's how I caught up with it, like I said earlier.
Yes.
I caught up with it just based on my physician that I just basically go and see every year.
You're right.
Wasn't sickly or anything.
Right.
She just watched it climb and increase, and then she said, we might want to take another look at this, and kind of sent me over to you guys and others.
Yeah.
And the rest is history.
Yeah, that's
but
why
here we
we're
are.
here.
So
people will take care of their vehicles and take it for maintenance every 3 months or however many times a year, but they will not take themselves to go see a physician.
Right.
Why? What's more important?
I know, but because we as men, and that's one area as a man that you really like, oh, what do you mean? You gotta, deal with my prostate, yet along my rectum or anything of that caliber. Like, whoa, those are off limits.
Right.
So how do you get men to understand and not to embrace it, because maybe not the best word, but how do you just understand that this is important?
It is important, and like I said, a lot of people have this idea that the only way to screen for prostate cancer is through a rectal exam. Okay. And for a lot of people that's very uncomfortable and they don't want to do it. But you don't have to do that.
Right.
Come, have the discussion and give blood, and we can start from there. And you may never have to have a rectal exam, if you don't want to.
Right.
But please do the screening.
Yes.
Talk to your doctor.
Yes.
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 And it's one thing. You may run away from this, and then it catches up with you later when it's advanced. While if you had done the screening earlier, we would have found the prostate cancer early and dealt with it, and you would have had a very good quality of life.
Yes.
Actually, maybe even better.
Yes.
Depending on what your sexual function was and what your urinary symptoms were beforehand, versus waiting and the cancer spreads, and now you're worse off because your options are limited, and we're giving you treatments that can give you a lot more side effects than if we had done it earlier.
And that's the other part about it, is that waiting to see, not literally waiting, but you could end up in worse shape than you could have did something early on.
Always.
Yeah. So
it's always better to find it early.
And it's tough. But it's tough more from a male's perspective, and trying to get us to understand this. But I guess the other approach too would be talk to the wives. And so if you had to say something to the wives, to say, hey, tell your hubby to get in here because just to be tested. That doesn't mean being tested that you have it.
Right.
It just means that you've actually ensured that you're doing all the things to make sure that you don't. And if you do, we can now hopefully either treat it, do something about it.
Right.
I mean, correct?
Yes, exactly.
Okay.
So, I mean, wives have a role to play as well to encourage their husbands to get screening, just general health screening, and part of which will be prostate cancer screening. So get your husbands to see a doctor at least once a year.
Yes.
And be open to that discussion about prostate cancer.
Okay, this has been good. And I really appreciate you.
You're welcome.
I mean, and I know you said once that you had some statistics that you wanted to kind of share, or do you, if you, we'll pass on it, but again, the best part about it is share just one last nugget or two with those that you would want to say to us as men. Definitely get tested.
Yes.
Definitely see your physician annually,
Yes.
just to say, hey, how we doing here?
Yes.
Versus surprise. And when the surprise comes, sometimes that could be, in most cases, probably too late, or it could be too late.
It could be too late.
Okay.
So, I mean, there's nothing more I can say that's more important than say, just go see your doctor once a year and have that discussion about your general health, including prostate cancer screening. That's very important. And there's a lot of misconceptions out there about prostate cancer biopsying can spread the cancer. That's not true.
Okay.
We have.
I didn't know that one.
Yeah.
Okay.
I have this discussion once in a while. People who come in and they're afraid of getting their PSA, or their PSA is elevated, and they refuse to have a biopsy because they're afraid if you do a biopsy, you're going to spread the cancer.
Got it.
There are no studies to show that it is safe to have a biopsy of the prostate. And at a minimum, have that discussion. Talk to your doctor and lay out your fears and let them show you the evidence, and they will convince you. But at least if you don't want to have a biopsy, monitor it. There are ways that we can monitor to make sure that we're not completely letting this go without
Well, I didn't just take you guys' word for it. I mean, I asked a couple of the physicians and kind of got a second, third, and fourth, and fifth opinion to say, okay, so something is going on here. And this is where it is.
Right.
Because we kind of checked everything else just to make sure. So, but I appreciate it though, Doc. And Dr. Masanji, I appreciate you guys and especially appreciate you sharing with my District Dialogue family.
My pleasure.
And so on that note, any closing remarks that you would like to say to us men, women, or whomever else, the importance of prostate cancer treatments, testing, to reassure where you are in this whole scheme of potential, that word that we hate to say, cancer.
Yeah. So the most important thing to remember is that prostate cancer can be treated. It is important to catch it early. So go see your doctor, have the screening, and know whether or not you have cancer of the prostate. It could save your life.
Thank you.
Yes.
On that note, I appreciate you and thank you again,
My pleasure.
Dr. Masanji. Well stated. Thank you, the District Dialogue family. I'm Commissioner Henry Mitchell III. Join me, as you'll see on the screen here, we've got Prostate Cancer Awareness Month, which will be in September. And we're gonna have a nice little rally where you can come and get tested. You can kind of find out where you are. And it's nothing more than, from my understanding now, I'm not the doctor, he is. It's a blood test that you'll take, and then they'll tell you where you are if there's anything to be worried about. So please, get tested. Mom, dad, wives, husbands, get tested. It's important. We want to save lives, and we want to make sure that you get tested. And we're going to create the engine to kind of get you there. So thank you for listening to District Dialogue. Again, I'm Commissioner Henry Mitchell III, and enjoy the rest of your day. Thank you, and thank you.
Thank you.